My son Evan, a healthy, active young adult, died needlessly from meningococcal disease. As a parent, you do everything to protect your kids, but no one told us about immunization. If they had, my son would have been immunized and would be alive today.
Each year, approximately 1,500 Americans are infected with bacteria that cause meningococcal disease, including meningitis. About 11% of infected persons will die despite antibiotic treatment. This potentially deadly bacterial infection can affect anyone. However, adolescent children and college students are at increased risk of getting the disease. In fact, adolescents and young adults account for nearly 15% of all the reported cases in the U.S.
When I was 15 years old, I contracted meningitis, which I thought was a flu. Within 24 hours, I was rushed to the hospital where they had to do amputations on my hands and my legs below the knee.
Of those who survive, up to 20% suffer permanent disability such as deafness, brain damage, and amputation of arms, legs, fingers, and toes. Meningococcal disease is very serious, but it can potentially be prevented through immunization. Many of the nation's leading medical and advocacy organizations have joined the National Foundation for Infectious Diseases to bring you this important message.
Meningococcal disease is a rare infection caused by potentially deadly bacteria. It can develop and spread quickly throughout the body. So quickly, in fact, that even with rapid and appropriate treatment, the infection can kill within hours. In the early stages, there are signs of what appears to be a mild illness. Often the infection is confused with the flu because the symptoms are so similar.
These symptoms may include high fever, headache, and muscle aches. Confusion, nausea, vomiting, and extreme exhaustion may follow. Later on, a stiff neck and a purplish rash may develop. The similarities between influenza and the early symptoms of meningococcal infection make it difficult to accurately diagnose meningitis before complications develop.
Bacteria that cause meningococcal disease are spread through coughing and sneezing or by direct contact with secretions from the nose and throat of an infected person. It's important to know that a person cannot prevent infections simply by avoiding those who are already sick. Bacteria that cause meningococcal disease can remain dormant in the nose and throat of healthy individuals. These carriers do not get ill, but they're able to spread the disease without knowing it.
Meningococcal bacteria enter the body and circulate through the blood. That bacteria swell the linings surrounding the brain and spinal cord and can poison the blood. A rash may appear on the skin. The infection causes shock, organ failure, gangrene, loss of limbs, or death. Within a short period of time, meningococcal infection can become uncontrollable. It may kill an otherwise healthy person within 48 hours.
Health experts are not sure why adolescents and college students are at high risk for getting meningococcal disease. What they do know is that cases of infection begin to increase when children enter the early teenage years, and that the number of cases peak between the ages of 15 and 24. Medical experts believe this increase is connected to activities that are common among adolescents and college students and put them in long-term, close contact with those who may carry the deadly bacteria. For adolescent children, the bacteria can be spread in a variety of social situations that put teens in close contact with one another, particularly living in a dormitory or boarding school or even attending sleepaway camps.
College students live in dormitories where they encounter a large number of students from varied geographic locations. They live and socialize together in close quarters, increasing their risk of being exposed to the bacteria. Studies show that smoking cigarettes and drinking alcohol may also increase the risk of infection.
The majority of meningococcal cases occurring among adolescents and college students in the U.S. can potentially be prevented with vaccination. The Centers for Disease Control and Prevention and some of the nation's leading medical groups recommend meningococcal vaccination for all adolescents 11 through 18 years of age. A good time to discuss meningococcal vaccination is during the pre-adolescent doctor's visit at 11 to 12 years of age.
The recommended vaccine protects against 4 of the 5 types of meningococcal bacteria. Vaccine research for the remaining type of bacteria is ongoing, and we remain hopeful that one day a vaccine will be available to protect against all 5. The vaccine is safe and effective. As with all vaccines, the injections can cause minor reactions, including pain and redness at the injection site, and can cause headache, fatigue, or a vague feeling of discomfort. The vaccine can be given at the same time as the routine tetanus and whooping cough booster.
The National Foundation for Infectious Diseases, in collaboration with our partners in the infectious disease prevention community, urges you to learn more about meningococcal vaccination for adolescents and college-bound students.
It's now one of my goals to help educate teens and their families about this disease and that there is a vaccine out there so that they can avoid it happening to them.
Vaccination is the best way to protect at-risk teens and college students from this potentially fatal and preventable infection. Please do all you can to stop meningococcal disease.
This did not have to happen to my son. I encourage you to become aware about this infection and help ensure adolescents and college-bound children are protected. Prevent meningococcal disease with immunization.